part of the medical team. We rely on the honest and accurate reporting of signs and symptoms and helping us successfully return our patients to good health. I would like to introduce Mr. Mike Sidowitz to the stage. Mike was finally caregiver for Junior Caregiver. He was diagnosed with PLL and had an allogeneic stem cell transplant 11/9/2010. Welcome, Mike.
First slide, please. So, first I'd like to thank Moffitt for inviting me here to speak. And I'm not a speaker, I'm not a scientist, I'm not a doctor, I'm a caregiver. And this is my story along with Bill's story and the journey that we followed along the way. Next slide. So, what you see up here is definition of the caregiver. But let me tell you what my definition is. It's a mother, it's a father, it's a sister, a brother, an aunt, an uncle, a husband, a wife, a significant other, a son, a daughter, a neighbor, a coworker, a friend, and the list goes on and on. Next slide, please. So most of us caregivers are homemakers, accountants, lawyers, waiters and waitresses, teachers, engineers, consultants, construction workers, musicians, artists, and the list goes on. I'm sure there are some in here that I didn't mention. In most cases, a caregiver that takes on this role is not in the medical profession. They're not a doctor. Now up on this screen, I'm sorry, go back one. Up on this screen is my example. I'm a CPA, I'm an accountant. I do debits and credits. What you see up here on the left side is TPN. That's nutrition that you give through an IV when a person can't eat and needs to get sustenance. On the right, you see pressurized home antibiotic balls, for lack of a better word, that completely filled our refrigerator when Bill needed to have home transplant infusion. So here's the accountant that does debits and credits, hooking up to the triple lumen, sterilizing it, hooking up the infusion, saline before, saline after, taking out the alcohol to clean it, and then doing the heparin lock to make sure that the line is clear so that it doesn't solidify so it can be used the next day. I'm an accountant. So, did we as caregivers truly, fully understand what was being asked of us? Did we know what we were signing up for? What I found out was that I and you were the confidant, the advocate, the lifeline, the cook, the 24/7 personal assistant, the worrier, and the protector. You, as caregivers, are the unforgotten heroes. So, Bill was diagnosed with TPLL, T-cell prolymphocytic leukemia. I couldn't spell it, I couldn't say it, I had no idea what it was. It was an aggressive disease. Before he was diagnosed with that disease, he was first diagnosed with CLL. Then the next bone marrow biopsy came back, and it was LGL. Then we came to Moffitt, and they did a bone marrow biopsy, and we found out that he truly had TPLL. He was treated with Campep and Cladribine, and we were very blessed in finding 2 of his siblings out of the 3 that were tested were a perfect match, 10 out of 10. Everyone's transplant journey is different. Some breeze through the process. We have a friend that his nephew had a transplant about a year and a half ago. And we tried to prepare him for what to expect. And on day 5, we get a phone call. They discharged me. And we're thinking, how could you be discharged? We were in the hospital so long with all these complications. Things have changed. Processes have improved. Therapies are, just as what was explained, are reaching new heights. So tomorrow will be Bill's 5-year anniversary of his transplant. He was a healthy 135 pounds when he went into the hospital. Here's his treatments. He had, trying to do this so I don't have to keep turning around. So he had 45 Campeth injections. Campeth is a very strong drug that is given subcutaneous 3 days a week for a little over 3 months. Bill went to the infusion center at home in Titusville and got his injections. He had 15 doses of cladribine. That was once a month, 5 days straight. 22 Neupogen shots, 1 Neulasta. T-2 was the last time Bill had any kind of chemo put in his body. 48 different drugs, medications that he took post-discharge from the hospital, and 5 bone marrow biopsies. Next slide. So, we started treatment up in Hershey, Pennsylvania. When he was diagnosed with LGL, there was a doctor up there doing a study, a clinical trial. So we ended up going up there only to find out that we were starting treatment right away for TPLF. Then we lived in Titusville, Florida. He got all of his infusions in the infusion center at Parish Medical Center. He also went to the local cancer clinic called Space Coast Cancer Center. And then, of course, he had his transplant here at Moffitt, and for that, we're forever grateful. Next slide. I'm sure everybody in this room knows this list, and then there were a ton more. And the reason I'm going through all of this is because the patient had all of these tests. The patient went through all of these different injections, needle sticks, x-rays. You, the caregiver, were there with them at every step of that way. Next slide. There were complications. Before the transplant, Dr. Ayala, who was Bill's transplant doctor, sat down with us and he said, you could have complications. You could have herpes. You could have BK virus. And guess what? He did. And the herpes was so bad that he couldn't eat. And in a later slide, we'll get to see what that did and what that looked like. BK virus. How many people in this room know what BK virus is? Okay, I see a couple of hands. BK virus, which we nicknamed Burger King, because nobody had a word for it. Or we said it had something to do with the bladder and the kidney. BK virus impacted his kidneys. And he was on continuous bowel irrigation, which was no picnic. And everyone had a Christmas tree when they went into Moffitt, which was their IV pole. And you walked around with that. Well, if you had continuous bowel irrigation on there, those bags were so big. And it was almost impossible to pull that IV pole. He then, after being discharged, had interstitial cystitis. So that's where your bladder sort of sloughs off and bleeds and has no lining. So the amount of pain that Bill went through for almost a year until that finally healed. Then pneumonia, and then he needed a hip replacement. Next slide. So what were his 100 days? And this is not a great picture, and I'm glad that everybody ate already, but this was mucositis, and this is what his tongue looked like when it was at its worst. So day 8, he got clots in his urine. That's when the BK virus started. The continuous bowel irrigation started on day 9. Then delirium set in. On day 10, I was told to call in the family because they didn't know which way it was going to go. And that was a very low day. His family was there within hours, coming from New York and throughout the country. By day 11 and 12, Bill turned around and started to show signs of improving so that the family could go home and not worry. Day 12, the mucositis set in. Day 13, signs of grafting. Day 58, one of the first slides I showed was the TPN. Here I am with this bag with all these different needles that I had to inject to give it vitamins and all kinds of things so Bill could get nutrition. He went from 135 pounds down to 112 pounds in less than 45 days. Then they inserted an NG tube through his nose so that we can feed him on day 66. And then on day 94, we went home. Next slide. So this is what Bill looked like at his worst. 112 pounds. Chemo caused his skin to slough off twice. And he didn't look very happy there. Next slide. This is Bill today. Next slide. So this is me, and those of you who supported someone who had a transplant, you know where I'm sitting, and you can see my bed to the left. What did I do to stay sane? I stayed in the room the entire time. I was there from the moment the first doctor walked in until the last doctor walked out every day. I was there. But what did I do? I worked remotely. I'm lucky that I had a job and an employer that allowed me to do what I needed to do from a faraway place and work when I could work and take, a family leave day when I couldn't work. The other thing that I did to stay sane was we created a blog. And that blog was what was shown when I first started. That blog is what allowed me to express what I was feeling, but also communicate with all those that were concerned about Bill. It was my communication path out to everyone to be able to not have to call me, who was already tired from dealing with all the doctors and all the results and everything else that was going on. But the other thing that the blog did was it gave everyone else who has found the blog, who has had TPLL, hope. Bill gets emails and phone calls from people all over the country who find his blog and want to ask questions. And as a matter of fact, there's a patient who just had his transplant here at Moffitt just about 30 days ago. He's been discharged, and he contacted Bill before the transplant, and Bill told him his experience and gave him some pointers, and we're going to actually meet him after this event today. And the one thing that we did was we made a commitment on the blog to keep in touch with everybody that read the blog, because Bill's disease is so aggressive that everyone that we followed that had blogs didn't make it like all of us here today, and we vowed to give hope and continue the blog forever so that anybody that was following knows that Bill is still okay and Bill is doing great. Almost done, I promise. Next slide. So we had a great team of doctors and nurses. Dr. Aiello was Bill's transplant doctor. Denise Lefebvre, who is everyone's hero and is always there for questions, concerns. Sandy Trigg, those are Dr. Aiello's nurses. And then I could list a ton of names, Nisha and Maureen in the clinic, who took Bill's blood every time he came, to Robert, the list just goes on and on, all the PAs, all the fellows. He also had a great team of inpatient nurses and doctors and the entire transplant team. But the most important member of the team was the caregiver. You were there 24/7. I was there for every doctor round. I was there to connect the dots. I was there when Bill was not, when he had his delirium and checked out for 2 weeks. I was the only one to experience every step of that journey, as did you. I didn't let anything happen to Bill, and I made the decisions when he couldn't. So I'm just going to read to you something that I wrote on the blog on day 33, which was December 12th. And in looking back at the blog now, it's kind of amazing not knowing what you were getting into. For all those future caregivers, I must say without hesitation, this has been by far the most difficult thing that I have ever done in my measly 46 years. Being a caregiver is a full-time job and then some. It's not just being there for the patient, it's being an advocate for the patient. There have been so many times where my being there for Bill has made the difference in the care that he is receiving. It could be someone such as the sitter that is impatient with Bill, or doing things that will agitate him, and suggesting solutions that allow everyone to win. Or understanding what he is trying to say when no one else can make the words out with the mucositis and swollen tongue. During the delirium, Bill would say things that would make sense to no one else, but I knew exactly what he was saying and what he was talking about, and I was able to respond. Those who have previously been caregivers, I take my hat off to you. You tried to warn me to have a support system, a backup plan, and to take care of myself, or I would be of no use to Bill. I listened, but I waited too long to cry out for help, which is always my nature. There have been days that have gone by that I don't remember. I have reached exhaustion on more than one occasion. And I'm sure some of you out there can relate to that. Next slide. Could we have all of the caregivers please stand? Yes, please give them a round of applause.